Hi, it's Dr. Parikh with Region Medical, and I'll be talking about lumbar spondylolisthesis. Now, this isn't something that most patients will have heard of, but it is a common cause of back pain that is not necessarily mentioned to patients. So you might go in and say, I have back problems and I have back pain, and they might do an x-ray, and the x-ray might show that you have some disc degeneration. But it could also show that you have a slippage of one bone on another called spondylolisthesis. Now on this x-ray here, this is someone who has multiple levels of disc degeneration, but they also have this big slippage. If you can see one bone to the other, this one slipped forward on this one. Now, someone such as this, they could just say you have arthritis and disc degeneration, but they don't necessarily talk about the spondylolisthesis. Now, why is that important? Because oftentimes spondylolisthesis is an instability of the bones, ligaments, and tendons that provide stability. So when we're bending, our vertebrae is supposed to bend in a certain way. But if your ligaments and tendons are loose, your vertebrae can start this way and it can be very unstable, and it could slide back and forth and could be a common cause of pain that is on top of, or even the primary cause of pain that's even the reason for the disc degeneration. So how do you know if it's a spondylolisthesis that's slipping? Well, one easy way is to do x-rays where you bend forward and you bend backwards and you can see how they're moving. You can even go as far as doing a digital motion x-ray, which is a live x-ray done where you bend forward and you bend back and you bend side and you bend side. And it shows what kind of movement is there when you're bending and twisting. Now, if it's showing that there's even a few degrees of motion, well, that few degrees over time can be more and more, and then it can contribute to, again, the disc degeneration that some folks have. And it can be quite extensive. But again, just because an x-ray shows that your disc degenerated doesn't mean that that degeneration is the cause of your pain. Sometimes we have to hunt a little bit further and you have to do those extra x-rays and extra imaging. Now, what do you do if you have spondylolisthesis? Well, big one is exercise. You've got to work on core strength. Lifestyle changes, that's another big one. So if you're obese or you're malnourished, some patients don't eat enough and they're too skinny, and their bones, their ligaments and tendons aren't holding them well. But more times than not, it's someone who hasn't been eating well. Could be obesity being one of them. But again, not eating right food, so making lifestyle changes, getting rid of cigarettes and alcohol. Those don't help you when you've got a back problem. You can do some manipulation, but you have to be careful with manipulation, because a lot of times if you go to someone who's really rough on you and they twist you, that can almost worsen the situation. Physical therapy certainly is very important. Massage, trigger point injections, various things like that can help. But when it comes to injections for instability, traditional injections don't work very well. The type of injections that work quite well are prolotherapy injections, where we are addressing those stabilizing ligaments so that we can go from it's moving too much to it's moving just right, it's moving in unison. And when it does that, it doesn't send off those pain signals nearly as bad or at all. And then you can go from a really severe debilitating pain to a very minimal pain that's very manageable. So it's an area that, again, a lot of docs don't even tell patients that they have spondylolisthesis. And sometimes it's just a finding that a radiologist mentions, but it could be a primary problem that needs to be addressed. So if this is something you have and you need someone to look at it further, certainly give me a call. If you have any questions or comments, please leave them in the section below.